Move your splints and everything.
Yes, sure.
All right, this way. Oh, it's all out.
Yeah.
1 second. Done.
When is this numbness going to go away?
It's going to be there for a month or so. It's slowly going to come down. Right? So you can see the improvement with the shape of the chin, with the nose. There's still a lot of swelling there.
Yeah.
I'm going to be putting some tape for you so this just gets a little bit tighter. Okay, before you travel. I'm going to show you the different views. Look at the side view. No, come down. Look at that. That's where you really see the improvement, you know. You see the way the entire face has come forwards. You've got a nice defined jawline now. The lips, the way the shape that's taken, the nose, the pointiness, all of that. And this side again, you can see the huge improvement. Can you turn for me a little bit? Yeah, cool. And now see, you can look in the mirror gently. So you can see the improvement. It looked like as if your two lips were really forward, jutting forward. And you have this waviness here. Look at this now. It's tight, nice angle from the neck, tighter skin, beautiful jawline, much proportional chin. And look at the lips too. The two lips were sticking out forwards. We call that bimaxillary protrusion. And we've taken care of that. And let me show you more on the views. And a similar view. So if you see here, this was like a nice C, like a convex profile. And so now it's pretty much straight. If you now look, come this way. Yeah, thank you. All of this is the bruising, okay? That'll all go away. It'll take some time. That'll go away. Maybe 3 or 4 weeks. I'm going to let the junior doctor remove these stitches, and then we're going to apply some steri strips. You will travel with the strips, and after a few days, like 3 or 4, we can just remove the strips off. And with regards to you inside, we're just going to clean up, and the stitches inside the mouth will stay, so we won't remove them.
Tell me, if you look at my nostrils,
Yes.
can you see the shape is different? I mean,
I think it's just some swelling. It's going to be fine. It's going to be fine. We're just going to clean and put. It's because of the, you can see here, the earlier shape to now. You see, the issue is the size of your nostril. We're not able to increase that. We're only able to increase the shape of the nose. So if you look here, this was round already, and this was in this direction. Now we've made it more oblong, and we've given a slightly better tip. We've taken this to a more proportional line, and here we've given a gentle curve. So, and we've tightened the skin around it. So all of this is going to look really tighter, if you see now, to earlier. And there's still a lot of swelling, so it will take time. Are you leaving today?
yes, I'm
Okay. So you still will have to take 2 more weeks of good rest after you reach Windhoek, right?
Yes.
All right. Maybe 2 more weeks of rest, and then after that you can go back to work.
Yeah.
We'll give you medications for 5 days.
Okay. Normally, according to the rules, we normally stay at least a month.
Cool. That's really nice. If you can stay longer and up to a month, that'll be really nice. Because that'll give you more time for healing.
Yeah, and the nice thing is it's winter at home.
Okay.
So I think the swelling will reduce much more.
Well, it doesn't matter if it's winter or summer. As long as you don't exert yourself, you give your body enough rest, it should be fine. And how's the rib side? Is it paining a bit or a lot?
Especially, only when I'm turning.
Uh-huh.
Like that, then
So you're not sleeping on the right side, are you?
I normally sleep on my tummy.
Oh my God. Okay.
Yeah. But
So
I
that's
can
good.
sleep on my back.
Yeah, you can
most of
sleep
the
on your
time.
back or on the left side, but avoid sleeping on the right side because then it tends to hurt more. Because the muscles inside, if you press it or if you move it, it can hurt more. Yeah. And sleeping on the tummy is not a good idea even for your nose and the chin because you can just easily bruise it in the night. I mean, supine is nice and sleeping on the tummy is not a good position anyways.
Yeah, that's what I'm told, but it's the most comfortable.
Okay, it's a good time to make a small change now, I guess.
Yeah.
Because you have a nose, you have a chin, and you have a rib harvested side to take care of. I think it's better to sleep on the back, like how you're supposed to sleep. At least for the next couple of weeks. Do you have any more questions there for me?
Oh, yeah, it was just basically whether.
Okay, the passage of the airways that
The
you said,
passage,
which is
yeah, the
that'll
passage.
become okay.
Yeah. Is the passage still the same?
It will be the same. It looks like it's a little difficult for you to breathe because we have stitches inside.
Yeah.
Once they dissolve, it will be fine.
Yeah. And those stitches inside, how
They
long will
dissolve.
they take? Because those are the ones that are quite irritating.
Yeah, it is.
And I'm just using a cotton swab now to.
No,
just here in
no,
front.
don't do much because it can breathe. It can cause bleeding. So it's best not to do that. Please don't do that.
Okay, that's
Okay, stitches inside the nose will take a month to resolve. Yeah, I know it's itching. What I'll do is we'll give you an ointment called mupirocin. You apply that ointment with a Q stick. That reduces the itchiness and it makes it little lubricant. Okay, that's what you will do. But you will not put anything else. And we will give you a letter so that they know that you can take recovery for 1 month.
Yeah. And
Sarah, one letter for her that she needs to take rest for 3 more weeks. 3 weeks will suffice?
No.
4 weeks? 4 weeks. From today, is it?
No. From the day I arrived.
Yeah, so that's what. So from the day she arrived, so 3 weeks from today, whatever. This is good. We'll give you that. And we also give you this follow-up number where you can message us. And that's it. You take good care of yourself. You can take bath if you want today. Head bath is fine with the face because we've removed everything, so you'll feel better. And
And you said the numbness, that will
slowly it'll go away. It'll take a while. Slowly. Within a couple of months, it'll become just totally normal. All right? Right. Awesome. And you never told me about the pain. There's no pain from the rib harvest side. Normally, if you're sitting, yeah?
When I was sitting, no.
No, that's nice. All right. So we have to look at the rib harvest site sutures also. Doc, let me know how it's healed and everything. Don't remove it if it's not healed. Because I think today is what, 8th day for her? Yeah.
My surgery was on the 22nd.
Yeah, so it's a little bit early, I think, 9th day
So
for the sutures. Can you take them off in your country?
Yes.
It's possible?
But it's just, you need to just.
Let us know.
As I said.
So you just check with the sutures, especially the ones on the chest, and let me know. Nasal ones all seem fine, but once they're removed, I will put steri strips there because, when she's traveling, it'll be better. All right, it was nice having you. Like I said, the first patient for us who came from your amazing country. And I haven't been to that part of the world, so let's see. If I have some reason, I'll come over to your country. Windhoek, yeah?
South African.
South Africa, yes, I do know.
Southern African.
Southern Africa, not South Africa, yeah.
Southern Africa.
Southern Africa, awesome. All right, you take care and see you.